In other news, the Deputy Health Minister, Dr. Joe Phaahla, conducting an oversight visit to health facilities in Mahikeng. It is part of his department's program to monitor the state of these facilities, not only in the province, but also across the country. Newzroom Afrika's Seboko is live to us from the northwest. Refileo, has that oversight visit gotten underway just yet? And where does this visit begin?
Well, that oversight visit, Michelle, it's going to start shortly because we are about to leave the nursing college here, and that's where the Deputy Minister will be making his way to the Mahikeng Provincial Hospital. Like I said earlier on, we were speaking about that hospital having experienced a shortage of staff. But you'll also remember that this is the hospital that had an incident where nurses had put babies inside the boxes, and it was due to the challenges of the neonatal unit there. And a couple of months later, we saw that there has been a revamp of the neonatal unit there. The Deputy Minister will be making his way to the Mahikeng Provincial Hospital to check, among others, whether that unit has indeed been done. Deputy Minister, thank you so much and welcome to Newzroom Afrika. Talk to us about your visit here today.
Well, thank you very much indeed. We are here to visit the Northwest Province, specifically health facilities here in Mahikeng. As you know, this is the capital city of the Northwest, Pirima. So we are visiting the MEC and his team to really have hands-on experience of the kind of challenges which they face, also the good things which they are doing. I heard you in your intro already talking about an incident which happened about 2 years ago, and before MEC Lehari. At that time, I was working with MEC Sambata when we had the challenge of the babies who were in card boxes. I've already got feedback to say that matter has been thoroughly addressed. So we are going to see just in terms of improvements which have been made to avoid incidences like that. But overall, my visit here with the team from the National Department is really to get a hands-on experience of the kind of pressures and also the opportunities which are there for improvement. Because at the end, at the national level, we provide support, we mobilize resources through our national treasury, get funds voted by Parliament, and we must report. We must report in terms of what have we done, working together with our colleagues, the MECs and their team. And they are the people who are really in the coal face delivering services. So if we are going to push for certain achievements, certain improvements, we have to have a hands-on experience. So I will be doing that, with the MEC, getting into this is a major facility. Within the Northwest, as you would know, it's Mahikeng, which is the capital. We have Rustenburg. Some years back, I visited during the COVID period. We visited the JST hospital in Rustenburg. The other time, we were also in Klerksdorp, Tsepong. We still have to make a follow-up there as well. These are the three big centers of health services. But of course, we must also just hasten to add that hospitals are really just the anchors, but the provision of health services go right up to the community. So beyond the provincial hospital and the psychiatric hospital, which is also important because, as you might know, October, as we finish October now, it's a World Mental Health Month. So we will also be visiting to see how the provision of mental health services is in this province. But we'll also be visiting primary health because that's also very important.
And another thing, DM, is when you're looking into mental health, one of the issues around prisoners that would be sent to the hospital and need their mental health checked on, something that also Parliament had raised before with you.
Well, not just Parliament. I think also just over a year ago, we had to respond to queries from the Inspector General, Judge Cameron, who looks after the correctional centers, the facilities, the well-being of the inmates. So there were these issues which you are raising. So will also be going there, because one of the centers here is one of the major centers for forensic mental health, including state patients, state mental health patients. So to see, because we have a lot of pressure, but at least in this province, it's unlike other provinces where we actually don't even have facilities, but we will be going there as well to see to what extent they are coping with the provision of services, to make sure that patients who have been examined, and even those who are, some are standing trial, and they then, there is an allegation that they have mental health problems. They have to be admitted for observation. So all those issues, we will be get hands-on experience in terms of what is the progress in this province in terms of providing those services.
Before I let you go, DM, obviously it's not a Northwest thing, but even just across the country, this forms part of the oversight visit across the country. Public health does continue to experience some sort of shortages of staff. There's an issue where patients, they will be complaining about the long waiting hours that they have, the shortage of staff that contributes to the impact or concerns around delays when it comes to critical surgeries. How is the department looking into these matters and measures that should be put in place to address such issues?
Well, on a regular basis, including the current year, you would be aware that we, to working with our colleagues, we always look at the gap in terms of human resources, both professional and support services, and we push for additional, because health has been underfunded for many years. I mean, there's not even a dispute. I mean, about a year ago, when we were discussing with Treasury, they admitted that we are shortchanged for up to 14 billion rand. So, but we're making progress. I mean, as you would know, the Minister of Finance did make an additional allocation of just over 6.7 billion rand, which is being distributed, amongst others, to look at the issue of improving the human resources. So I've already got the report in terms of the Mahikeng area. It's not looking very bad, but one of the things which, as you have raised, is the waiting times. I was really querying the numbers which they were giving me. So one of my first stop here, because part of the delays is in the record management system. Sometimes, even before we talk about consultation, just the management of records, where people sometimes come and tell you that I've been here and they can't find my file. So those are the things which, as we start now, in the hospital, because we are developing systems working with the provinces to also digitize our record management. But we want to see, we have a system called Health Patient Registration System, HPRS, which should be, is still being improved. What you call electronic health record management also. So all those things, those are the things which we'll be looking at. But again, so it's not just the staffing, but also systems, which it's in the outpatient, sometimes also in the dispensary. When people have been seen, then they wait long times waiting for medicine, and sometimes shortages of medicine. So all those things I'll be looking at here, so that when we plan with MSCs nationally, we are also informed by practical experience, not just the paper report. If you're not on the ground, and you might sometimes, I'm not saying his team will falsify and give us rosy reports, but sometimes when you don't get to the ground and see, you may actually think everything is fine, only to find that there are many challenges which need to be improved.
DM, thank you so much for your time. Deputy Minister of the Department of Health, as they are going to start now, will be moving Michelle. This is where we will be making our way to the Mahikeng Provincial Hospital. Like he had indicated, he'll be checking, among others, if that neonatal unit indeed has been refurbished following that incident about 2 years ago, where babies were being put in card boxes. But he was also talking about the shortage in terms of finances, so that they can be able to address, among others, staff shortage, medicine in some instances, but also an issue of infrastructure of these health facilities is also of great concern that needs to be looked into, Michelle.